navigating the future for a better health. And taking over the stage will be Dr. Stephen Grogmeyer, Institute Chair, Oncology, Cleveland Clinic, Abu Dhabi. You will recognize him from being with us over the last few days. Please do give Dr. Stephen a huge round of applause. Dr. Evelyn Bischoff, who's the founding VP, Healthy Longevity Medicine Society, who's flown in especially to join us. Please do give Dr. Evelyn a huge round of applause. And please do welcome back on stage our wonderful moderator, organizer, M42, key person behind this with the full M42 team, Dr. Fatima. I'm going to hand over to you directly to take over the stage. Thank you.
Thank you so much. Please welcome. Salam alaikum. How are you? How are you feeling? Health Tech. We had, I think, 98 speakers in M42 for 36 sessions. Thank you so much to all of you, and thank you so much to all our speakers. We spoke a lot about technology. We spoke a lot about innovation. Let's speak now about the impact on cancer, the impact on prevention, and mainly longevity. I'm very pleased to have with me Dr. Stephen and Dr. Evelyn. Dr. Stephen, I think you were with us in a lot of sessions during these 4 days. We spoke a lot about precision medicine, about digital, about optimizing patient care, patient-centered care, how this is impacting the cancer treatment, prevention, and longevity. The question will be the same for you, Dr. Evelyn. Let's start with Dr. Stephen.
Okay, well, good afternoon, everyone, and thank you for the setting this panel up. I think it's extremely important. And I'd like to begin by talking about the importance of using precision medicine as we go forward. And it relates to the projected incidence of cancer in the UAE in the next 15 years. So a recent article in The Economist predicted a 230% increase in the rate of cancer in the UAE between now and 2040. So this is a call to action. It's incumbent that we use the tools that we currently have and that we continue to work together to develop tools so that we can prevent many of these cancers. And I think the opportunity is here now and will continue to get better in the future. Let me give you a couple of examples of that. So we've been working for the last 3 years with the Emirati Genome Project. Over 500,000 Emiratis have had whole genome sequencing. So that information is available. And one of the projects we're working on now is using that information to identify patients who are at very high risk for cancer before they get cancer. Because we now know through lifestyle interventions and increased screening and certain other interventions, we can significantly reduce the risk of these patients getting cancer. So this is a tool we already have, we just need to use it. There are other areas of precision medicine that we need to use to improve our patients and all people's health. And we now have the ability to use the genome to assess the risk of patients for certain diseases. So one technology that's available called SNPs. So we can use SNPs, which are small changes in the DNA, and we can use those to actually predict the risk that a patient will get a certain cancer or other disease. And if we could bring those into the clinic on a daily basis, then we can start to identify patients who are at the highest risk and again take steps to increase their ability to have a long and healthy life. And then finally, I want to mention this area of better understanding the diseases that we do develop. We now, with genetics, can take a sample of a tumor and we can do sequencing on it. And not only can we identify patients who need treatment, but we can also importantly identify patients who don't need treatment. When I was in medical school 20 years ago, 30 years ago, we would take a certain patient with cancer and everybody would get chemotherapy. Turns out that not everybody needs chemotherapy. And now using precision genetics and personalized medicine, we can prevent patients from getting exposed to medicines that actually don't help them. So there's a lot going on and a lot of excitement for the future, and I'm very glad to be part of this panel.
That's amazing. Thank you so much, Dr. Stephen. Dr. Evelyn, the advantage is you are an oncologist but also you are specialist in longevity. What do you think about the initiatives that Dr. Stephen was speaking? Do you think that ultimately this will optimize the longevity?
Absolutely. First of all, thank you so much for having me. It's such a delight and honor. And coming from the field of oncology, it's how I get into healthy longevity. And I think the tools that we have in healthy longevity primarily come from the research and from the study and from the experience with the patients in cancer. So oncology has been definitely very pivotal for everything that we have, not only in terms of, yes, the SNPs analysis and the genome sequencing, the use of genome-specific sequences to determine if the patient is at high risk or moderate risk or low risk. So if the patient is actually in need of chemotherapy, and percentually then we can say what's the risk of recurrence of cancer. But at the same time, we have great technologies now also to detect cancer at an extremely early stage at the level of DNA, right? So liquid biopsies are a tremendously important part both in oncological practice, daily practice, and in healthy longevity. But at the same time, as we evolve, we learn, and AI learn with us, just much faster. Therefore, probably with those tools that we are developing right now and already applying, we will know even more so in the future how to detect not only the very early disease or even the risk of statistically developing a specific cancer, but a very specific risk for a specific person at a specific point of time of their life for which type of cancer entity they will be at risk. And then how can we mitigate that? Not only by lifestyle interventions, not only by optimizing whatever we have in a very generic way, but with very, very tailored approaches, and partially also with approach that involved either technology or pharmacologics.
I'd like to add that I completely agree. And this idea of screening, first using screening technologies that we have is important. Right now, if you look in the UAE, I would suspect that less than 30% of women who are eligible or should be getting mammographic screening aren't getting it. But there's reasons why they're not getting it. And we need to take on that as a challenge and, for instance, work in developing better ways to screen. Screen younger women when appropriate, screen them with less discomfort or, without exposure to radiation. So we're now working with our partners at G42 or M42, and we're working on developing a blood-based test for breast and other cancers, which again would allow us to more easily find cancers at the earliest stages. And there is no doubt that when we find cancer at the earliest stages, patients need a lot less treatment and their prognosis is much better.
Thank you so much. Then what about survivors? Okay. How can we support from both sides?
I think we sing to the same choir. That's a beautiful thing. So maybe I can take that. So survivors probably will very soon be the largest population among cancer patients, and recurrence is one of the biggest problems, but at the same time also resistances to different types of treatments are a big problem. And both of those are tackled with two things. Number one, how do we identify those people who are at the higher risk of recurrence, and that's partially done by screenings. How can we follow them up more frequently and much better in much more details? That's the blood tests, and also different other tests that we can do much more early, and also since the costs are not as expensive as, for example, doing a PET CT every 3 months, it will be just allowing us to be more on the top of frequency, and also allowing people to be less scared every time they come for a PET CT and for a follow-up. And last but not least, those who have resistances in therapies, knowing that they might develop a resistance very quickly to a specific family of drugs could allow us maybe to either adjust the dose and find. So it will definitely, all those technologies will help us to be more personalized for those patients, both in identification and triage and interventions and follow-up.
Thank you so much.
Again, I completely agree, but let me add to that. We've been so convinced. I work at the Cleveland Clinic at the Fatima Bint Mubarak Center, and if you look objectively at the data which we now have, which associate risk of recurrence of cancer with some very basic lifestyle things, It's overwhelmingly positive. It's overwhelmingly positive. And I think for far too long, we've not taken advantage of that. Patient gets cancer, they see the oncologist, all the dialogue is about which pill the patient should be on, how long they should be on it, managing side effects of medications, things like that. But if you look objectively, and we've done this, if you look objectively at the data that's there, weight management, exercise, healthy diet, stress management, in large, well-done clinical trials published in the best medical journals, significant reduction in the recurrence of cancer. And these are the same things that help us prevent from getting cancer. And it turns out they're largely the same things that prevent us from getting other things that, like heart disease. So these are very simple things. And so the question we've asked and we've started to tackle is how do we impact our patients directly using these very basic principles? So working with Dr. Nicole, my colleague at Cleveland Clinic Abu Dhabi, we established the Center for Healthier Living. Every cancer patient who comes, newly diagnosed patient or recurrent patient or established patient, who comes to Fatima Bint Mubarak Center is offered and recommended to have an appointment at the Center for Healthier Living. We feel so strongly about this, we offer every patient appointment. We have a group of physicians who have studied all these issues and as they relate to recurrence and compliance and different things. A group of specialists see these patients, and we strongly encourage them not only to see them but to follow the pathway, because with these very basic things, people can live longer and also reduce the rate at which their cancer comes back. And I believe there's a lot more science that's behind this, and we need to continue to study this and continue to understand how our genome and other parts of our physiology relate to this and how we can further take advantage of this in the future.
Thank you. Dr. Evelyn, future for better health. I guess that the longevity and the research that you are doing are not only related to cancer, chronic care, chronic condition. Can you tell us a little more, please?
Sure, with pleasure. So yes, indeed, it's not only related to cancer. It extends to all the people, including those who have chronic diseases and also those who have no diseases at the moment, at least not apparent disease. And we want to bring them from the status of healthy to the status of optimal health, for the optimal performance. So for this already we have quite a bunch of established diagnostic tools. Similarly to the Center of Healthy Living that we are also collaborating with, we have a bunch of 360 degrees diagnostics from biological age in different measurements, from telomeres to methylations to blood through skin and so on. And of course all the functional biomarkers of aging that we can assess, and including all of the genetic screenings, proteomics and so on. So a lot of data that we can then use to personalize interventions and to track the patient really not only with wearables but also with other monitoring tools and optimize. And the measurement of the outcome is really either to lower down the biological age or to keep it at least at the same level, while unfortunately the chronological we cannot stop. So that's a little bit what we do, and early prevention is of course a part of that. But the whole idea is really to make sure that the health span is preserved. It's not about, longevity has this annotation of living longer, which truly is not our goal. If it's a side effect, it's good, okay, but the health span is the most important.
Absolutely. Let me share my speaker with our attendants. Anyone want to ask our speakers, please? Any question?
Hello. Dr. Stephen, just in regards to what you're saying there, having the rehabilitation centre for oncological patients, I guess as much as the science is catching up, for a long time we've known the benefits of lifestyle modification and the difficulties maybe justifying that in the face of pharmaceutical trials and having hard evidence elsewhere. But on the other side is sort of cultural, societal buy-in, which, you know, relevant here, relevant elsewhere. How have you found that, you know, do you see that time is the biggest hurdle in regards to really shifting the perception in regards to how influential those kind of centres can be, both pre and post?
Great question. Certainly compliance with programs such as the one we have is a big issue. I think it's all of our jobs. So family members, most of us know somebody or in our family or a friend who's had cancer, so supporting family members. Knowledge is power, supporting our family members. It's our job as a medical team. The patient hears it not just from me, but hears it from the medical oncologist and the radiation oncologist and their primary care. People start to get it. And I think it's all of our responsibility to continue to work to change the perception of the importance of these things. And it does take time. It also takes some success stories, and there's no doubt we have lots of them. I have patients that maybe came to see me, overweight, unhealthy, metabolic syndrome. They've used their cancer diagnosis to completely turn their life around, and now they feel better than they ever have. They have an outlook on life, and their prognosis is very good. So I think success stories help, continuing education, and this will all slowly continue to change the perception. Good question.
Thank you.
I have
Please.
Dr. Stephen, I have one question. As you mentioned, in 2024, even ahead, there are 200% chances for the more cancers. As you know, a lot of the medications, a lot of the technologies came in the market. So where is the lacking? Why it's happening like this? You know, why it is increasing day by day?
Yeah, we've thought a lot about this, and in the United Arab Emirates in particular, historically, there's been a very young population. In general, not completely, but in general, cancer has been a disease of older patients. So we're seeing a currently young population over the next 15 years get older. So I think that's part of why people are estimating a rise in the rate of cancer. The other thing that's happening in this country in particular is a lot of immigrants coming into the UAE. So the entire population is growing. And then finally, I would say some of it may be due to, as we've seen perhaps in other countries, is the westernization of, for instance, the diet or lifestyle. So in some Asian countries, there's also been a shift in increasing numbers of cancers, more cancers in a pattern that's more consistent with the Western world. And a lot of us believe that may be due to, when you go to Japan, people are eating McDonald's where they didn't used to do that. So I think there's many factors that may be contributing to this, but it's something that we should all pay attention to and work together to correct.
Can I ask you, Dr. Stephen, do you have any question for Dr. Evelyn?
Yes, I do.
Please.
Of course. We were talking about it earlier, but I think it's of great interest to the audience. There's a lot of discussion now about the microbiome, and so we were talking earlier. One of the questions we get that I would like her advice on, and I'm sure you would too, is people ask us, what probiotic should I be taking, or should I be taking a probiotic? It seems that if your microbiome is right, that it leads to being healthier or associated with being healthier. The question is, how do we decide which one, how much, how long?
Right. We had this discussion before, and it's a very evolving field and very important one. We know that microbiome plays a role in almost every part of our systems, from cognition through our metabolics in general, cardiovascular health. Has a very big impact on also in terms of cancer predisposition, and others. I definitely do not recommend people to take pre or probiotics just like that, without any control or without any knowledge of the baseline. And I'm very strict in terms of what kind of probiotics or prebiotics are being taken if the patient really insists to do that. But optimally, there is a test, optimally with quite a bit pellets, so not only knowing approximately which bacteria are there, but really with identification of each strain and the amount, because we know that quantity and diversity of microbiome are the two main components. And then based on that, we can decide, is there at all a need? It's very differing between women and men, and at each stage of life, it's also a different need. And we see a lot of bacterial overgrowth. So side effects of abuse of prebiotics or probiotics in patients, and that actually causes problems in gut and other health systems, to the point that we saw a patient, I will never forget it, where she had a back pain to the point that we saw something growing in her spine, and we opened her up because that's what we needed to do. We thought it's a cancer. We open up and we see it's a yogurt coming out. So basically she was overgrowing bacteria she had an internal yogurt production. So it was very, very bad. It can go wrong. So it's important to do it in the right way, test before, get a baseline, get the right probiotics and prebiotics. There is a lot on the market for the reason that we don't need everything. More doesn't help more. It's really the choosing wisely approach.
Looks amazing. And then, Dr. Evelyn, any question for Dr. Steven?
Yes.
Please.
So we are in oncology, and it's extremely important and interesting for me, also things that we just mentioned, the cancer types that we see across populations, right? Yes, we see the trend that younger and younger people are coming with first diagnosis of cancer, but also the types, that the entities are very different. So my question was, what's here? What's in the UAE that is predominant?
Great question. And it's very important that we study the cancer in the population that we serve, because as pointed out, I came from the United States where I worked most of my life. Now I work here. But it turns out that the pattern of cancer is different in the United States than it is here. It's different in India, it's different in China, it's different everywhere. So we say that the cancer problem, there's some similarity, but it's really unique to the region. So we've studied this here in the UAE, and it turns out the most common cancer in the UAE is breast cancer. We see it occurring in younger women than we do in other parts of the world. We're still trying to understand why that is. Other kinds of cancer that are particularly common here, thyroid cancer, for reasons we don't exactly know, colorectal cancer, blood cancer, prostate cancer. So some things that are in common with other parts of the world, and some that are different. One particularly interesting bit of good news is we don't see as much lung cancer here as we see in other parts of the world, which has been a little surprising to us. I haven't studied it, but our perception is that the smoking rates here may be a little on the high side, and we were expecting to see a lot more lung cancer. And so now we're trying to understand why that is. Is it due to a young population? Is it due to different types of exposures than you see in other parts of the world? We don't really know, but nonetheless, it's an interesting question.
Thank you so much. Dr. Evelyn, takeaway from the session and from Arab Health, please.
Well, takeaway from me, and maybe this is something that is obvious to everyone here, but for some maybe not, is the area, the country, the region is doing something that will be once again pivotal and leading in the world, which is the biggest percentage of the population globally is being screened properly here. So not only do we learn as physicians, but also AI. So we will very soon probably be able to answer many questions that we were not able to answer before with the data set and with the work that is being done here, not only in cancer, but also in any other type of medical diseases. And second takeout for me is the excellence in everything that is being done is very important, but also the collaboration. So the collaborative spirit is super important. As we see here, we see people from all over. The more collaborations we will have, the more we will advance, because the ethnicity-based studies and also the interdisciplinarity is crucial.
Thank you so much. Dr. Steven, takeaway of Arab Health and of the session.
So this, for me, has been a great conference. I spent more time at Arab Health this year than I have in any of the past years. I've learned a lot. My takeaway would be that there is so much already in front of us, that we're not even utilizing to the maximum. And if the simplest thing that we do is utilize the tools that we already have, we can have a major impact. So an example of that which we discussed was using the Genome Project to find patients who are at already high risk. And the important thing is there's something we can do about it, and we can help these patients and their families. And some very basic things are right in front of us. And then on a positive note, there's so much also at the next level right beyond that that we need to continue to collaborate and take advantage of. And I think it's true that we can really lead the way, and that's one of the reasons I'm here, is because I firmly believe that we're in an ideal position to do that with our partners at M42 and all of those who are here.
We firmly believe it, all of us. Thank you so much, all our attendants. Thank you so much, our speakers. M42, we care about prevention, not only curing, not only healthcare, we care about health. We spoke about innovation, application, and health. Thank you so much, everyone, and see you next year.